Beta blockers are drugs used to treat high blood pressure, angina, and heart arrhythmias. Sometimes they are also prescribed for tremors, migraines, overactive thyroid, and glaucoma and other eye diseases. These drugs block the effect of adrenaline on receptors called beta receptors in the heart, lung, and blood vessels. They can reduce the heart rate and block stimulatory responses, and so calm anxiety and reduce body tremors, including tremors of the hand. Although this talk concerns their use in certain sports, other people use them for things like stage fright. This is because they have the effect of reducing anxiety in acutely stressful situations, such as during a stage performance or anything that might cause heightened anxiety. This anxiety-reducing effect is more likely when the anxiety is manifested in bodily sensations or complaints, such as trembling or heart palpitations. They are not considered as effective for worry and mental anxiety. Here are some examples of beta blocker drugs. Irresponsible use of these drugs can cause some severe adverse effects, some of which could be fatal. General side effects are fatigue, depression, sleep disturbance, nightmares, cold fingers and toes, low blood sugar, and sexual dysfunction. They could also trigger an asthma attack and, worst case, cause a heart attack. Beta blockers are prohibited in certain sports that require fine motor control, such as archery, shooting, driving, sailing, bobsled, and synchronized swimming. They are also prohibited in certain skiing events. They are unlikely to be used for endurance events, as they would impair performance rather than enhance it by limiting heart rate and cardiac output, and could be dangerous in an endurance situation. It was shown in the 1980s that using beta blockers could improve shooting performance. This caused them to be banned by the International Olympic Committee. Since shooters are trained to pull the trigger between heartbeats to avoid any slight movement of the arm that might occur during the heartbeat, it was at first thought that beta blockers helped by slowing down the heart rate, which gave the shooter more time to aim and shoot. However, it is now believed to be likely that the drugs actually work by reducing hand tremors directly. The Olympic Doping Code lists beta blockers under classes of prohibited substances in certain sports. The governing body of each sport, such as the International Federation, is responsible for rules and testing for beta blockers. Such testing is done only at competitions. Athletes who have a real medical need for beta blockers can get their doctor to prescribe an alternative medication to treat their condition, and Olympic athletes may be able to ask for a therapeutic use exemption from the Olympic Committee Medical Advisory Committee.